Now, you were a doctor and you're a survivor, so you've been in the dark and you're out. What lesson do you think the world can learn from Nigeria? Because I believe Nigeria used just the basic things to survive, and we had a lot of survivors, you know. So you're shocked that in America, somebody can still die because you have a lot of the facilities and everything. Do you understand what I'm saying? So what are some of those little things that the world can learn from the Nigerian lesson, you know, that can also help people, more people, to survive from the disease?
Shaka?
You might, of course, have added Senegal.
And Senegal.
I guess I would say, having visited Nigeria a couple of years ago and visited, now I'm a family physician, so I was visiting with family doctors there, looking at their training programs. At the moment I was there in 2012, there were 10,000 family physicians in training around Nigeria. You look at a country like Liberia, and I think Sierra Leone and Guinea are in similar situations. The numbers of doctors there, that, you know, a lot of it has to do with the healthcare personnel available. Nigeria has done extremely well with universities, training centers, residency programs. You have a very well-educated medical workforce, and so you have people who are equipped to recognize this disease, to follow proper procedures in isolating it quickly. You have some public health people, some epidemiologists and public health people who were able to set up that system quickly to trace contacts, to, you know, to make those differences. Now, some of it is also just simple infrastructure in the country. I mean, in Sierra Leone and Liberia, there are places you can't even get to in the rainy season at all because the roads are so bad. So you can't even reach there. The village has Ebola outbreak and no car can even get there. So some of it is infrastructure, some of it's, I mean, you have a very well-educated healthcare workforce. You followed you did the contact tracing right away, immediately. There was not a lot of denial. People were not waiting around for 3 months saying, we don't think this is Ebola. People recognized it for what it was, pursued it quickly, did the contact tracing. Even when people went to another city in another state, they followed them there and they tracked them down and made sure they were isolated and monitored and treated as well, of course, but monitored and isolated. Those are the things that Nigeria did, and you did very, very well with that. And I think we can all follow that. But I think part of it is that you have to have certain things in place, pre-existing. You know, when you have a nation like Liberia with less than 100 doctors doing clinical work, it's much harder to attack a problem like this aggressively. And so I think it is a challenge. Health education, training doctors, training nurses, getting a workforce in place. And my appeal to, again, all of Africa and the whole world would be really, don't forget about West Africa when the last case of Ebola has gone away. We still need to rebuild and build up these health structures through training and other activities to get that kind of public health infrastructure that Nigeria has in place in these countries.